Welcome to this episode of TAC Tic Talk. I'm Joe Bush, editor and chiropractor of the American Chiropractor magazine. This episode, my sister Jacqueline Touzard, publisher of the American Chiropractor, and myself interview Dr. Brian Jensen. Dr. Brian Jensen wrote the article in the September issue of the American Chiropractor magazine, The Chiropractor's Influence on Ground Force Reaction and Lower Extremity Arthrosis. Join this interview in which we go through not only this article, but how Dr. Jensen became interested in being a chiropractor and what that means for his patients. So thank you for taking the time to meet with us today, Dr. Jensen. I'm with Dr. Brian Jensen, chiropractor in Roanoke, Virginia. And Dr. Jensen is a longtime author with us here at the American Chiropractor magazine, writing as an expert on biomechanics and foot motion. So recently you had an article on the topic of what was the title was The Chiropractor's Influence on Ground Force Reaction and Lower Extremity Arthritis, in which you really laid
Arthrosis.
Arthrosis. Okay, so let's try to do that again. All right, so the chiropractor's influence on ground force reaction and lower extremity arthrosis. So I'm here with Jacqueline Touzard, the publisher of the American Chiropractor magazine. And we wanted to know a little bit about that article. Me as a chiropractor, Jacqueline, of course, uses orthotics all the time. And so can you tell us a bit about ground force reaction, something you mentioned in the article? How does this impact degeneration or the changes in the structures of the knee, low back?
Yeah, my own personal story started with this long before arthritis developed. And as a kid, playing sports like a lot of us did, we succumbed to a lot of little injuries and a lot of little things that just kept recurring. And, we were given the really good advice, well, you need to stretch more. That's the problem. Or exercise more. You need to lift more, get stronger. And I think my junior year of high school, my knee gave out playing football one night. And it was just one of those, no one hit me. It was just one of those freak things. And as time goes on and you go to chiropractic college, you start learning about some of this stuff. You go, oh, this is something that is the result of bad biomechanics. And by the time I was 25, just out of chiropractic college, I had low back pain all the time. And I got access to adjustments all the time, but the pain would always come back. And right before I started my practice, I went to it was the national convention that Activator had in 1988, and Foot Levelers was there. And I thought, what's a foot company doing at a chiropractic convention? Because, we went from occiput to sacrum, and that was about it,
Right.
And they explained the feet and how they create our foundation and how they're involved with movement and all this. And I'm thinking, this is kind of embarrassing. I studied architecture before I became a chiropractor. And this makes sense. And so I put their device in my shoes, and it changed the way I moved. It changed my biomechanics. My pain was gone in a week. And I realized I got to start looking at feet, because if I ignore the feet, and that's the cause of the low back problem, they're going to be in that same loop that I was in. And it was dissatisfying to me, and I don't have to pay for care, right? we get free adjustments, but it was creating problems in quality of life, et cetera, et cetera. So as I began looking at all of my patients' feet, I saw that everybody, I don't know that there's an exception, everybody is a little bit asymmetrical in their feet, which causes the knees to be just a little bit asymmetrical, and the hips have to adapt to that. And now we have that pelvic torsion that we see all the time on everybody. And that's the foundation for this process that takes decades to recognize, because it's insidious and it's not painful for decades at times. And in our modern culture, we have access to pain relief, and that's what we want. We want it yesterday, free in the mail if possible. And as soon as we have relief, we're happy, but we don't realize that we're declining in function as we go. And no one really has an answer for that. Medically, the answer is, things to cover up symptoms, it's shots, cortisone, et cetera, until it's so bad that there's nothing that we can do now except for replace the joints. And that's great technology. I'm glad that we have it. Some people that I know have benefited greatly from that. I just would prefer not to participate in it if I can. And I've asked all my patients, if you could choose, have it replaced or not replaced. Nobody wants to have them replaced. And so I think we need to be a little more proactive as chiropractors and start looking at these things early on. I mean, that's the best time to look at these things. And so I start with kids if I can. But if I've got someone that comes in their 80s and they've got all sorts of knee and hip arthrosis already, um, one of the little smart aleck things I tell patients is that you can't unboil a hard boiled egg, but you can stop cooking it.
Right.
We've got to stop this process if we can and
Hmm.
preserve as much as we can and improve their quality of life as much as we can. And they still may need a medical intervention at some point in time. But we
Hmm.
know that virtually every foot pronates a little bit excessive and it's asymmetrical, and that transmits bad biomechanics up the kinetic chain. And our body is going to respond physiologically as it's designed, and it's going to create inflammation and it's going to deteriorate tissue. And we have an opportunity to intervene and stop that process.
Well, that's very interesting and insightful. That's an accident from high school football is what led to kind of your discovering this, right? And
Yeah, yeah.
so, can you talk a bit about the knee replacement, hip replacement? I mean, is this something you see prominently in your clinic where people are like, I've already had this done, can't go back, right? And do you get involved in their care at that point?
Yeah, absolutely.
Just what about you? Is that something that you were able to avoid?
I've been wearing orthotics for 35 years now. I got them when
Mhm.
I was like 26 or 7, 20, 25 or 26. So my knee, if I overdo it, if I overuse it, I get an inflammatory response because of the previous damage that's been done. But it functions perfectly. I mean, I can squat all the way down to the floor and hang out, and I can stand back up under my own power. So the knee itself is
Mhm.
very, very functional, which is amazing because it was very unstable before. Uh, of course, being physically fit, which I'm certainly not in the physical fitness that I was years ago. And that's
Mhm.
one of those things that we have to continue to fight for a little bit. But I think that's a really important thing to keep in mind also is that the strength of that quadriceps muscle, that's the primary stabilizer of the knee joint. And when it's inhibited, and that's one of the things we talk about in seminars, is that neurologically, when that foot pronates excessively, it literally turns off the quad muscle to a degree. And so it's
Mhm.
inhibited. And so it can't stabilize that knee as well as it should. And so the secondary stabilizer has to kick in, which is the ACL. And what's funny is that most people don't know where their hips are, but they know what the ACL is because someone on their team blew out their ACL playing their sport. And
Mhm.
but yeah, if I see that big scar in the front of a knee, I know that their feet have been contributing to that wear and tear that has resulted in that surgical intervention. So again, you can't unboil a hard-boiled egg, but let's stop cooking it. They still have bad biomechanics working on those joints.
It makes total sense to me. I recently tore my ACL, but so I haven't gotten the surgery. Of course, I don't really. I'm not motivated to do that. I have been wearing the orthotics though regularly and actually from year to year, I've seen an improvement even in my arch. I don't know if that's typical, or if I'm just an outlier on the metric. Is that typical, Dr. Jensen, that you would see an improvement in your arch?
We, we do see some changes in the arch a little bit, but it's not long-standing. If you were to go without
Hmm.
orthotics then for a month or so and we remeasure that the amount that the
Yeah.
navicular bone drops, it would probably
Hmm.
go back to its original laxity. The plantar fascia goes through that plastic deformation. Wearing orthotics all the time will engage muscles a little bit differently. But if we
Hmm.
remove that intervention, eventually those feet will continue to flatten out.
So very interesting. What about the patient demographics in your clinic? Can you talk a little bit about that? Are they coming in for acute pain? Are they coming in for specifically trying to avoid a knee surgery, perhaps, or is this are you
Yeah,
really focused on extremities, or is it?
not my practice is very broad based. I mean, I treat
Mhm.
babies to centurions, and I think generally we're seeing more of this baby boomer population getting into their 60s and 70s, and so that I take care of a lot of people probably between the ages of mid 40s to mid 80s, and that's probably half my practice. And so I see a lot of that. And again, they're coming in typically, like most chiropractic patients, with acute pain. And
Mm-hmm.
most of it's been coming on for a long time, but they want some pain relief. When I look at them, I say, look, we're going to help take care of your pain. That's why you're here. But I'm going to look at some things that may give you some long term advantages, some long term benefits that no one else has ever looked for. Um, you guys are in Panama, we're in the U.S. I got to believe that the mentality, the medical systems are very, very similar in that they intervene on an acute basis, essentially, and it's put a patch on the pain. People would like to have some longer term solutions. They just have never heard of them. No one has ever offered them to them.
Mm-hmm.
So that's kind of where I start is let's take care of your acute issue, but going forward, let's intervene in ways that will improve your balance and your gait and reduce your risk of trips and falls, which are a huge part of our elderly population's problem. We had Dr. Ted Carrick with us this past weekend at a little conference, and he talked about the cognitive decline and the decline in brain function, and traumatic brain injuries from falls and things like that can make the brain perform as if the patient has Parkinson's or
Wow.
dementia or even Alzheimer's
Mm-hmm.
as a result of brain trauma that we've had. And so that's kind of a frightening aspect. And when
Mm-hmm.
you start talking to people about these types of things, they say, you know what, I'd really like to do something to improve my balance and to improve my gait so that I don't trip and fall, that I can walk more easily. And when we look at the feet and we address the feet and we see the neurological changes that take place as a result of that, I mean, these changes take place almost immediately,
Mm-hmm.
and people can feel improvements in their balance and stability. And so I think we have an awful lot to offer, not just our older patients, but the younger generations, as they all want to get older, but
Mm-hmm.
they don't want to feel old when they get there. We want there to be something left over. And that's just really not been part of our culture for decades. And we have
To,
I think, a huge opportunity to take advantage of that.
Mm-hmm.
to me, it seems like the younger generation kind of gets it a little bit more. I don't know. I don't know what is causing that, but maybe staring at the screen. At least the kids who come into my clinic on a regular basis are understanding the whole physics behind everything. Like you with your architecture background, I don't know. Maybe
Yeah.
the educational systems are better, more developed, but it's really striking to me how the dental profession has just thrived so much on aesthetics and like how things look, and then you look at the feet. No one ever looks at their feet. Like it's like total. I mean, there may be a segment of the world that I don't necessarily interact with all the time that looks at the feet a lot, but
Right.
they have they have all these differences. Even my kids will have very pronated feet, and it's like but no one ever tries to talk about how that can impact their life for the long haul, right? So, and
Yeah.
soccer players having different length limbs and things like this as they grow, and how that impacts not only the arch but the degeneration in the knee. It's pretty striking to me. Jacqueline, I think you had an experience where you had a little injury in your leg at one point.
Oh,
Did you ever? No, have you ever really assessed your gait? Jacqueline was a gymnast. Not many people know this, but so
Ah.
she frequently will be doing cartwheels or jumping for no apparent reason, and she'll pull a muscle or something.
it
So
was
that's
after
something
COVID,
that
Joe.
happens.
Thank you, Dr. Joe. After
Mhm. Yeah.
being with the lockdowns from COVID, the first time I went out for a long walk, so I was well warmed up, but I was literally leaping for joy, doing some old
Mhm.
gymnastics, leaps, and I tore a muscle there. But I don't think it had anything to do with the orthotics or anything. So,
No, she had
I
none.
don't
She
think I
had
had
none. But
I don't think any
yeah.
orthotics in the shoe. And quite
Mhm.
frankly, I was probably wearing a lot of flat flip flops throughout COVID. So let that be a
Right.
lesson to you. If you're going to be on your feet a lot around the house, make sure you got some of the good ones. I don't think I had the
Right.
the good ones back then.
Mhm.
Thanks, Joe,
So
for ratting me out for
yes.
that. But
Well, but Jacqueline, you kind of have a gait that's not so fluid, right? But you've got orthotics. I know you use them regularly. So
Mhm.
um,
Well, let me
Now,
check what
do
I
you have,
wanted to jump in and ask about really quick, because I know
right?
we don't get to talk with Dr. Jensen very often. He's definitely a great contributor and writer, but also, I don't know if you guys, Dr. Jensen, you speak quite frequently in the industry, don't you?
I do,
How
yes.
many times a year are you speaking in engagements, and are they nationally located or regional?
Yeah, I speak basically all over the country. I've been speaking for foot levelers for about 16 years now, and I
Wow.
think I've spoken in 43 states and several
Wow.
countries around the world. So, um, yeah, I go wherever there's an opportunity to share some information. I speak at some state association meetings. I speak at some college events, some homecomings, and then we do our own license renewal seminar series and some workshops and that type of thing. So I don't know, maybe an average year is 15 events a year, something like that. So
Wow.
it's
But
not
that
nearly as much as it was when I was there full time, but
But still, and to hear that you have a fully practicing, operating clinic in addition to
yeah,
that, to me, you're one of my behind closed doors kind of guys that I always want to know, like the bird's eye perspective of how you've seen the profession, in those past 16 years with all of that travel, and you get
yeah,
like a different perspective each state you're in, the people you meet, the
yeah.
associations you interact with.
It's been a huge blessing in my life to be able to travel and to be introduced to. I mean, I've known you guys for years now, and I would have never come across you hadn't it been for going to all these different events that we get to go to. I mentioned Dr. Ted Carrick. This guy
Hmm.
is an icon in our profession, in the
Hmm.
world of healthcare, and he's one of us. And
Hmm.
I think one of the things that has really jumped out at me over the last, yeah, probably 15 years or so, is the progress that we've made in the world of neurology, understanding neurology better, understanding the brain, and how that applies to what we do as chiropractors. And so we can be way more intentional with how we treat patients now, with very, very targeted outcomes regarding their neurology, regarding, I mean, obviously pain is the number one thing that people know us for, but chiropractic is so much more than that. And when I look at the effect that we can have on all aspects of health, on digestion, on
Hmm.
hormone production, on uh, the ability to adapt to a stressful environment. And I actually, having come across Dr. Richard Barwell several years ago, I actually did EEG studies in my practice for about 8 years.
Hmm.
And
Hmm.
there's not very many of us that were doing brainwave studies in practice. But what it showed me is that almost all of our patients are living in a fight or flight state.
Yeah.
They're in a sympathetic, dominant neurological state. And so it
Hmm.
messes with their digestion, it messes with their sleep, it messes with their immune system function. It causes tight muscles, it causes gait issues. I mean, it causes all these stress responses
Hmm.
that we just kind of get used to. And
Yeah.
we try to figure out ways to calm our body. And some of them are taking medication, for anxiety and to sleep and for digestion problems. And chiropractors are the answer to that because we're the
Right.
ones that can help them down regulate that
Mhm,
abnormal neurological activity. We're not going
mhm,
to get rid of stress, but
mhm,
we can raise the threshold for what our
mhm,
nervous system is capable of living in and handling. And
mhm,
it's exciting to not only help patients with pain and knee and hip problems, but people with anxiety problems and heart palpitations and big digestive problems.
mhm,
And that's where chiropractic shines. That's why I became a chiropractor. Hearing all these stories about what BJ Palmer did way back in the day,
mhm,
Harvey Lillard regaining his hearing, that
mhm,
was really exciting to me. And I think for a long time, our profession kind of got away from that because we got into that back pain, neck pain mode, and insurance was paying for it, and that was easy.
mhm,
And we have a tendency sometimes to default to what's
mhm.
easy, and I
Right.
think that makes us a little bit lazy. And I
Right.
don't want to be accusatory of anybody.
Mhm,
Hmm.
I could accuse myself of being lazy in some ways, but I think there's opportunity for us to do a lot more than maybe traditionally we have looked upon chiropractic as being able to provide. And that's why I take an extra minute. I look at the feet. I have them do a
mhm,
little functional squat test. We
mhm,
talk about those physiological things that I just mentioned. Tell me
mhm.
about your sleep. Tell me about your digestive problems because you can tell people have those things.
Right.
just by talking to them a little bit. And
Mhm.
Right.
it's just, we're in a really exciting profession and a really exciting time, and people are looking for answers. I think access to information on the internet, on social
Mhm.
media, has also increased our visibility. And
Mhm.
I have a new patient that comes in, and I say, okay, how many TikTok videos have you watched about chiropractors?
Right. Yeah.
And
Do you do the why? Do you do the Cipriano yank or whatever?
right. Yeah. Yeah. I only get that question every week.
You're like, can I let's look at your gait? How about that?
Yeah. Yeah.
It's not as exciting on TikTok, Brian, but it is interesting what you say about the neurology stuff, especially when you think back to like Muhammad Ali and how he took so many beatings and how he ended up.
Yeah.
And really, Dr. Jensen, the intervention and just adding in things like orthotics, and if people use them regularly throughout their life, the way that changes their whole experience with the world, right? I mean, how many people do you know that are happy? Like, what would you say the percentage of people that have had like a hip replacement are like happy with the outcome out of 100%? I
You're
mean, just
breaking
off.
up on me
Don't
just a
worry.
little bit,
It's if you
Joe.
don't feel
Now you're
comfortable
frozen.
answering it, we'll just edit it out. But I'm just saying, like, do you have? I mean, we all have hip replacement patients, right? But they don't end up at the level they're comfortable with, right? I mean, that's my experience. How would you say about that, Brian?
I met this lady that had a hip replaced by this world-renowned surgeon, and after the surgery, she couldn't pick her leg up. She couldn't engage her hip flexor to pick her knee up, and so she went back to the doctor, and they did the X-ray, and the hardware was exactly where it needed to be. The wound had healed properly. There was no infection, and he said, "You're on your own. I've done my job." So, and some of these guys have bedside Tourette's, I think, not very good with patients. And so she was on her own, and for 5 years struggled at work trying to walk with a leg that she couldn't pick up, and she'd have to use a walker by the end of the day. And she actually saw me speaking. I got invited to speak to a group that works with the VA here in Virginia. And when I got done talking about the feet and biomechanics, she went to her room and called my office and made an appointment. And so she comes in, and so I look at her feet and I do all the stuff that I do. And when we can't engage the hip flexor, there's a reflex that I was going to test and see if we could change that. And so I stimulated a reflex on the quadricep muscle. And for the first time in 5 years, she was able to pick her knee up during my exam.
That's awesome.
Wow.
It was fantastic.
Yeah.
And with the orthotic intervention, with chiropractic care, and we did a few other things, a little decompression and stuff, she was able to walk normally for the first time in 5 years with this hip. So the hip can cause other issues. I mean, these surgeries can
Mhm.
cause other issues,
Right.
and there's no follow up to function. Is it in there?
And oftentimes there is a back
Oh,
issue, right?
huge.
So that is incredibly insightful. And you don't hear these types of success stories where you're saving a person's well-being and
Right.
life basically by saving the surgeon's job, right?
Yeah.
But they got enough hands off,
Right.
right?
Well,
So
and the other thing is, if the feet were a contributing factor to wearing out the knees or the hips, we replace the knees and the hips,
mhm,
but we never do anything with the feet. And so you're still going back into the
mhm.
Mhm.
same biomechanical function that wore those joints out to begin
Mhm.
with. Now, they're probably not going to wear out because they're titanium or whatever they are, but
Mhm.
you haven't changed their gait, which will affect low back stability, pelvic function,
Everything.
cervical function,
Mhm.
shoulder function. And it just, I don't know.
The
We're
foundation.
we're the
Well,
craft.
it's what drives you.
It is.
Right. Well, no, and exactly what you're saying is dead on accurate. I'm so grateful that you wrote this article on what we can do as chiropractors to help patients avoid that as an outcome. Of course, we can't avoid every hip
Right.
surgery, right? But we can still help even after the
Absolutely.
surgery. And so that's what's important to remember. We're all on the team for the
Yeah.
patient, right? And we just have to be that much better than everyone else, right? Because we joined this profession called chiropractic, which inherited a discriminatory practice,
Absolutely. Yeah.
with the medical physicians. But thank you very much. Everyone should be looking for Dr. Jensen's article in the upcoming issue of the American Chiropractor magazine in September. And also look for Dr. Jensen in your area speaking on behalf of foot levelers, wherever they may be in upcoming seminars.
Do you have anything you wanted to add in there,
Well,
Dr. Jensen, for our listeners?
just that if anyone, after seeing this article, if anyone's got any specific questions, I'm always open to receiving an email from somebody. That doesn't happen very often, so I throw my email out there all the time, and come to some seminars and get some of this really simple, basic information. It'll change your life. I mean, one of the things I love doing is helping chiropractors get healthier too, because we're subjected to the same wear and tear our patients are, and I'd like to see people continue to practice because they want to, not retire because they have to, and that's a big issue. So it affects chiropractors too, and I love that aspect of going out amongst our peers and meeting them and speaking with them and helping them out as well. But we're Foot Levelers puts on a lot of programs. They have a lot of great speakers, and it's a lot of really practical information that people can use in practice. So look forward to seeing everybody out on the road at some point in time.
Well, I wanted to add in because we always like to say we're walking the talk. We like to work with people who are walking the talk from a family of chiropractors who do the magazine for chiropractors. Working with you, Dr. Jensen, you don't only practice chiropractic, but you're actually walking the talk, going out there in the trenches with the doctors and teaching them all as well to do as such with their feet, so they can all walk the talk, but that much better.
You bet.
Keep
I
up.
appreciate everything you guys do too. It's great being with you again.
Well, thank you for your time, Dr. Jensen. As chiropractors to help patients avoid that as an outcome. Of course, we can't avoid every hip surgery, right? But we can still help even after the surgery. And so that's what's important to remember. We're all on the team for the patient, right? And we just have to be that much better than everyone else, right? Because we joined this profession called chiropractic, which inherited a discriminatory practice, with the medical physicians. But thank you very much. Everyone should be looking for Dr. Jensen's article in the upcoming issue of the American Chiropractor magazine in September. And also look for Dr. Jensen in your area speaking on behalf of foot levelers, wherever they may be in upcoming seminars.
Do you have anything you wanted to add in there, Dr. Jensen, for our listeners? Mm-hmm. Mm-hmm. Mm-hmm.
Mm-hmm.
Right. Mm-hmm.
Perfect.
Definitely.
Well, thank you for your time, Dr. Jensen.
Because we always like to say we're walking the talk. We like to work with people who are walking the talk, from a family of chiropractors who do the magazine for chiropractors, working with you, Dr. Jensen. You don't only practice chiropractic, but you're actually walking the talk, going out there in the trenches with the doctors and teaching them all as well to do as such with their feet, so they can all walk the talk, but that much better. Keep up the great work. Hey,
All right.
thanks.
You have a good day.
Bye bye.